Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arno, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area. Good morning, everyone, and welcome to another episode of Taking Good Care. It's a very exciting podcast today. We have a dear friend of ours, Dr. Kendell Banack, who is joining us from rural Alberta, specifically Camrose. And we have her here today because of her expertise, but also because we've just known each other for so long. And we know that she's really good at what she does as a psychologist and just a really, really good and positive person. So Dr. Kendell Banack is a registered psychologist in Alberta and a registered clinical psychologist in Ontario. She is certified as an EFT therapist through the International Society for Emotion-Focused Therapy and is certified as an advanced therapist and supervisor through the Institute for Emotion-Focused Family Therapy. Kendell currently resides in Alberta and supports clients in both Alberta and Ontario. She has formerly practiced in community, hospital, and private practice settings. And Kendell is the founder and owner of the Center for Restorative Mental Health, a group psychological practice situated in Camrose, Alberta. And you can always find Kendell at her website, www.crmh.ca. And she is on Instagram at crmh1 and on Facebook too at Center for Restorative Mental Health. So welcome, Kendell. Thank you for being with us today.
Thanks for having me.
Wow, what a treat. I have been looking forward to today for probably since Kendell said yes to this. So our very first guest on the show, part of what I was looking forward to is just learning more about EFT myself today. So can you tell us a little bit about your journey and what got you started and how you started with EFT?
Yeah, for sure. And I will just say too, it's like such a delight to be here. It's such an honor. And I'm also just excited to have this conversation with the two of you. I'm usually practicing in the therapy room and I don't always have the opportunity to talk about what I'm doing in this kind of way. So it's just a unique opportunity to do that. So my EFT journey began in grad school. I had the good fortune of having Dr. William Welton as my supervisor, and he was trained and supervised by Dr. Leslie Greenberg, who is the primary founder of emotion-focused therapy. So I am very grateful for this early introduction to EFT. There aren't many people who have that privilege. So in grad school, I trained specifically in the application of EFT to bulimia nervosa and kind of designed my dissertation around this. Over the course of many trainings and consultation and supervision, I became, certified as an emotion-focused therapist. And I also, over the last, 15 years ago, started training in emotion-focused family therapy with Doctors Joanne Dulhanty and Adele France. And that also was a great and enriching journey, learning about how to apply EFT concepts to families, to support parents, to support their kids who are experiencing emotional behavioral challenges. And then over the last 6 years, I've really delved into EFT for couples through a lot of training and supervision and consultation. And, I continue with regular consultation. Les is actually one of my supervisors right now. So I get to meet with Les and have support through Les. And I also meet with others for couples consultation. And I guess part of what I'm saying is that this has been a long journey for me, and it is a journey I can imagine continuing over the course of my career, over my lifetime. And this is something I really love about EFT is that I can continually hone my skills so that I can better serve my clients and those I supervise. And there's also this element of like I have found the work and the training to be very personally transformative as well. As I am supporting clients to befriend their own inner world, it also demands that I'm familiar with and can befriend my inner world too. And so that's just been a really, really special, enriching journey and something I love about EFT.
That's really cool, Kendall. I guess in the psychology world and even for our listeners, there's so many different modalities of
Mm.
therapy, right?
Hmm.
So you'll hear about like cognitive behavioral therapy. That's probably like the most popular. And even when we get
Yes.
referrals into our clinic, we get people just throwing out CBT. Do you do CBT? My doctor said I need CBT. So you have those modalities, and now you've got like acceptance and commitment therapy. You have all sorts of different therapies out there. What is the foundation of EFT from your perspective? Because someone could say, well, CBT has emotions thrown in there too,
Hmm.
as part of like the triangle of cognition and emotions and behaviors. What makes emotion focused therapy different?
Yeah, I love that you bring up CBT. And I was also like thinking about this as I was preparing and thinking about the podcast. And yeah, there are so many different approaches out there, and many of them are geared towards changing how you feel by changing how you think. Right. And there has been this cognitive wave in psychology. I think it began around like the 1970s. And, shortly thereafter, cognitive behavioral therapy came along, CBT comes along, and it became the therapy of choice. And due to the cognitive wave, there has been funding for large scale randomized controlled trials in large institutions for people to study CBT and the efficacy of CBT. So it is a well known and well regarded modality for good reason. There's a lot of evidence for it, and it holds good standing in the field. And like you said, Andrew, if you've ever been to a doctor and you've been recommended to go connect with a therapist, you've probably heard of CBT. So at present, something, EFT has been around for ages. Les was doing kind of work in this area in, I think late 70s and certainly in the 80s. But currently, there is increasingly recognition of the role of emotion in our human experience, in addition to the importance of working with emotion in the therapy room. We aren't just thinking beings, we are feeling beings with attachment and emotional learning histories. And we bring this into every experience. As we're learning more and more about our brains and how they are wired, there is a growing body of scientific evidence to support a focus on emotions. And, just for example, the work of Stephen Porges in polyvagal theory, it
Mm.
speaks even, to the role of the autonomic nervous system and the vagus nerve in our behavior and our well-being. And all of this happens out of our conscious thought world. So for me, focusing on emotions is just really, really interesting. And there are other modalities too that focus on emotion. There are a number of approaches that support emotion regulation. There isn't just EFT out there. There are presence-based therapies or mindfulness-based therapies. There's DBT. And not for all of these approaches. There's even, I think, and you might know this, but they're bringing in kind of more kind of emotion focus in a CBT world. There's talking about emotion. Often in these approaches, it's more from a psychoeducational standpoint.
Mm.
So if we are approaching emotion from a psychoeducational standpoint, we might talk with clients about emotions. We might talk about strategies they can use when emotions get big, like taking deep breaths or clenching fists or calling a friend or other distraction techniques like going for a walk. These are all coping skills, and coping skills are great, and coping skills have a place. We all need coping skills. And coping skills are also really difficult to call upon in a moment when we are swept up in emotion. So, when I'm thinking about examples of this, like just think about the last time your partner even raised their eyebrow at you, or like that tone of voice came across, right? And all of a sudden, your body's already reacting physiologically, right? Like your body might get tense, you might feel hot. Words are already coming out of your mouth, like your body is firing up. And this happens so fast. Or, another example, think about when your child falls on the playground. You might have a quickening heart rate. Your breathing might increase. You're fired up and you might be running for your child even, before you know it. There's this rapid responding that happens so fast. And in moments like these, when we're triggered, it's really difficult to call upon coping skills because we're operating from a different place. It's really hard to go like, oh, wait, no, I'm going to clench my fist and count to 10 before I use my very angry words towards my partner, right? It's like, that's really, really, really hard to do.
Kendall, I'm laughing because I just had this conversation with my wife the other day. Our youngest, he, has all these grand plans for, preventing him from being too angry and breaking stuff. So he's like, we'll put this in my room and you need to just ask me in this way to go to my room to cuddle with my snuggie or something like this.
Right.
And we're like, all that goes out the window as soon as he gets angry, right? They're like, hey, remember we talked about all these strategies and they're just gone, right? So sometimes talking about it when we're calm doesn't translate to like, yeah.
Right. And of course, coping strategies have a place. And like I tell my kids, we talk about strategies too. And like, my daughter will sometimes say, like, oh yeah, mom, I was feeling really tired. So I curled up and read a book. It's like, oh, what a good strategy for taking care of yourself, right? Like there is a place for that. And yeah, it's so hard to call upon in a moment when we're triggered. And what we know now, based on how our brains are wired, is that we react first based on quick emotional appraisals, and logic comes later. So we have this rapid automatic response to triggers that are precognitive. And this rapid responding is adaptive largely because it allows us to respond really, really quickly in any given situation, often for our own safety.
Yeah.
So the brain is wired in a way that the amygdala pathway is shorter and transmits signals more than twice as fast as the neocortex route, which is involved in higher level brain functioning. So what this means is that emotional responses are happening before the cognitive brain can intervene. And I find that fascinating. I find that, brain science fascinating. And so, an example that Les often gives in trainings is that when there is a snake in our view, our bodies are reacting physiologically and emotionally before the visual information comes through our eyes, goes through our visual pathway, hits our occipital lobe, and our thinking brain goes, this is a snake, run. Right? Our bodies are already physiologically reacting. And so what makes EFT so compelling to me is that we work in an experiential way. We are actually working directly with emotion. We are bringing it alive in the room. The idea is not that we're talking about emotion, it's that we're feeling it in the room and figuring out a different way to turn towards it. We experience it together. We name it. We figure out what it is telling us. We learn that we can tolerate it and we can figure out what we need. And when we can transform our emotion, when we can befriend our emotion, we open up the possibility of a different reaction in the face of a trigger without having to go through that long cognitive route. So, for example, when therapy goes well, when there's a good outcome, a client might come into another session and say something to me like, I saw that man who abused me and I was okay. I didn't crumble into pieces on the floor. I didn't go to that place of shame. I was okay. Or a client might come in and say, it was so weird. Like I texted my boyfriend and he didn't respond for 4 hours. And I didn't go to that terrible place where I was freaking out and feeling like he didn't care about me anymore. So it's really like I think about EFT as a way we can support clients to regulate from the inside out.
That's so
Um,
interesting.
mm,
So I think what you said was really interesting about the brain and the pathways, because
mm,
in the moment, in a circumstance and you're put in that moment, whether it's in the face of your abuser or like with your example with the snake,
mm,
it's in the moment, it's real.
mhm,
And so yeah, you've got these neurons firing. And
mhm,
I guess my question to that is, okay, if you are to now revisit that in a session, right? You're not in the moment anymore. And sometimes I
mhm,
find this with clients.
mhm,
And
mhm,
now you're trying to retell perhaps what happened, and you're trying to perhaps elicit emotion.
mhm.
Are we then bypassing that amygdala pathway like you talked about, where you get like the instantaneous emotional response and now you're thinking about it, right?
Mm,
So, and does the
mhm,
thinking
mhm,
then, does it ever become an obstacle to elicit the emotion that,
mm.
do you see
Mm.
what I'm asking
Yeah,
there?
I think so. Is it kind of like, can our thinking get in the way in a session, right?
Yes, exactly.
And like, I guess the EFT framing for this often, first of all, I'll back up and say that there is a shared conceptualization EFT. There's a very strong emphasis on the relationship. And so there's hopefully safety for this and a shared rationale for why we're doing the work.
Hmm.
And of course, when we might be going over a trigger with clients, their thinking brain can get in the way. And how we frame that in EFT is that it's a marker for, this is the clinical language, a self-interruptive split. So it's like there's this part of them that's stopping them from going to that emotional place. And then we can approach that with
Mm.
curiosity about, because there are often fears about that. Like, if I go into that place where I feel that terrible loneliness and that abandonment, I might not be able to come out. That might be too much for me. I've heard clients say things like, if I feel that, I might be obliterated. Like,
Mm.
like there might be nothing of me left. Like entering into our emotional world is a really, really scary thing. And so, yeah, we totally expect our thinking brains to get in the way. It's one of the most common parts of the work in early EFT therapy is supporting clients to kind of work through those things that stop them from feeling what they need to feel to get out to the other side.
Yeah.
Does that kind of answer that
Yeah, it does.
question?
Because
Yeah.
I often find that too. I know, Dave, you had mentioned in a previous episode that you don't work with emotions as much.
Mm,
I like to
mhm,
think that I try to. And so I'm probably in the middle ground between, you, Kendall, and Dave. But I do find that there's that obstacle sometimes where if we are starting to get into something a little bit more in depth, or I know that this could be like a bigger issue that I'd really want to try and tap into, that sort of obstacle or the defensive mechanism sort of comes up, and it's like hitting a brick wall at times because they don't want to go
absolutely.
there.
Absolutely. And it's like, of course you don't want to go there. This shame is the last thing you want to feel, right? And so we can name that brick wall that clients hit, and we can validate that brick wall that clients hit and bring curiosity to kind of the purpose that serves. I always tell clients, like, human beings are clever and they do things for a reason. Like, there's a reason you've been avoiding this feeling. There's a reason you don't want to go here. And so, yeah, one of the first things is usually honoring that and giving space to that wall that they come up against and hit, and opening up space. And of course, I mentioned, like, I've been training in this model for years. So, in EFT, we are trained in different ninja moves. Sometimes I like to think of
I
them
like that.
to kind of like, ninja might suggest something really harsh, but yeah, like special moves to support a client to kind of get to the other side of that part of them that comes up in those moments and tries to block them from experiencing.
So I got to jump in, Andrew, because I don't want the listeners to. I got to correct this because I actually work with emotions a lot. So I know whatever comment I said way back then, that is like my training in Hakomi, and even, when I'm working with couples, it is largely from an EFTC perspective, right? So what I was going to ask you, Kendall, is like, so some of these, let's say, male clients that come in and they've largely created all of these strategies to not feel those negative emotions, right? And then they're asking me going, why would I do that? Like, why would I even want to do that? What's the point of feeling sad or shame, or like, I don't like, that's not what I want out of therapy. So, how do you explain this in a way that might help them understand why it might be in their best interest to actually feel the feelings that they've been working so hard to avoid?
Yeah, that's such a great question, Dave. And, I'm even trying to think about what I tell my clients in moments like this. And I think it does just kind of come down to the case conceptualization with my client. And let me just see if I can kind of come up with an example of one.
Well, maybe I'll piggyback off of what you were saying, because I'll let you know kind of how I approach it sometimes. And again, a lot of this is not my stuff, but I picked up over training, and so I don't know exactly where it's from. But they talk about supporting the defenses, right? So it's like you have come up with a creative way to survive, and like you said, human beings are creative. So at some point in your life, it would have been really terrible to be stuck in that emotion, and maybe you were even left there by yourself, so this is different. And I think about little kids, right, as they're experiencing these kind of harshness of life, so of course you don't want to feel that. Nobody wants to feel these terrible feelings. Like,
Of
we are
course.
pain avoidant humans, right? Like,
Absolutely. Absolutely. That's so great. And I love kind of the compassionate, validating language and the way you can share that with Dave, kind of inviting them into that and normalizing that experience as well. And, as I'm thinking about it, and this is kind of like the horse before the cart a little bit, because there's a whole piece of, emotion theory and how we case conceptualize and whatnot. And we share this with our clients. But in the first few sessions, I am just getting to know my client's story, and I'm kind of paying attention to when they're hijacked from their emotional experience and what they are avoiding, and what emotions are comfortable for them and what emotions aren't comfortable for them. And then, if we come back to what they're hoping to get out of therapy, and I don't know if it's somebody who is experiencing depression, often there is kind of a strong self-critical component to their experience. And, we can talk about how, you know, we say things like, you've got to feel it to leave it, is one of the
Mm.
phrases that we say. And
mhm.
we can talk about how, like, that critical part of them gets really loud and makes them feel awful. And I think we need to bring curiosity to that to figure out how to get through. And, as we continue on our work together and kind of understand their experience a little bit more, sometimes it's also like, wow, you had a really critical father. And it's like that is kind of how you've always been treated, and now you're relating yourself to yourself in this way as well. And I'm curious about some of that pain as well, right? And so we
Mm-hmm.
just try to provide, yeah, like it's hard on the spot without a client example, but really try to provide a clear case conceptualization for why we're doing the work. There has to be a very strong rationale. Otherwise, clients are going to be like, no, I'm not going to that place. I've like organized my entire life around avoiding going to that place. I have great coping strategies, right? It's like, I would rather feel this, debilitating anxiety rather than the shame I feel. Or, I have those suicidal thoughts that I go to rather than feeling like this terrible shame or abandonment. Or, I would rather, I'm thinking about the case of eating disorders, even though
Mm.
binging and purging and everything else is awful, it's like that is so much better than feeling this other garbage that I don't want to feel. Like if I'm engaging in these coping strategies, I don't have to feel all this other stuff. So yeah, there has to be a very strong rationale for the work that we're doing.
Mm-hmm. It
Yeah.
sounds like being able to, the clients would have an experience that they actually can tolerate those emotions, that it doesn't destroy them. And maybe at some point in their life, like if they had the critical father, it was dangerous to show those emotions, right? So
Hmm.
if they have a new experience in therapy with their therapist, right? Like,
Yes, yes, exactly. That's exactly the point, Dave. I love that you can kind of see it like that and bring it up. It's like that is the point, right? It's like one of the hopes is the self-efficacy piece. It's like, yeah, you can feel this and you're okay and it's less scary. It's this befriending our inner world. And yeah, I forget the other pieces you were saying, Dave, that really resonated with me, but you can absolutely come out to the other side, right?
I think for me, Kendall, the piece that really shines through is like the amount of safety and trust you have between the client and the therapist.
Hmm.
If you're going to feel this vulnerable with somebody and entrust that you're going to be safe in that environment, like it's that trust and the sense of safety is paramount to this type of therapy.
Absolutely, Andrew. I love that you bring that up. Les talks about EFT as islands of work in an
Mhm.
ocean of empathy.
Wow.
I love that,
mm,
right? It hits me every time. Like that is first and foremost the priority in EFT is that ocean of empathy because you're right, there has to be so much safety to do the work. And something that I really enjoy about EFT is that there is, really good focus on how we can create that safety. And as I reflect on that, part of that is on this focus of on the moment by moment experience of the client,
Mm.
attending to not just the words, but the facial expressions, the movement in the leg, the holding of the arms or whatever it is, right? This is attending to the moment by moment experience is one of the basic principles of EFT. And so yeah, when a client is sharing a story of their past or of their week and their voice drops or their leg starts shaking or they change the subject because we're really great at kind of getting away from things that are painful. I'm attending to these indicators that something is touching in on an emotional place for them. We also just know that the therapeutic relationship and the safety is the most important factor for change and for outcome in therapy. And so in attending to this moment by moment experience, I'm always striving to communicate to my clients like, I see you, I notice you, I'm here for you. I'm accepting you. I'm not judging you. We're making sense of this together. We're here in this together. And so this like attending to the moment by moment experience has really deepened my capacity to be with a client in a really kind of special, different way than we might encounter outside of the therapy room. And yeah, I think that does help clients to feel seen and accepted and understood.
And I think for, the listeners to know, Kendall exudes that warmth,
Mm.
not just within this podcast today and not just within her therapy sessions, I'm sure, but as a person, we all went to grad school together, but she exudes warmth even outside of all of these settings. So I think perhaps that's also why EFT resonates with you too,
Yes.
because you make
Yeah.
everybody feel safe around you. So that's always been my take with you, Kendall.
Oh, that really touches in my heart, Andrew. Like I'm really enjoying deeply feeling into that. And I can even feel tears push at my eyes. That's really special to me. That you felt that warmth and that you experienced me in that way. And I think too, you bring up another really good point is it's like I love EFT. I also hold respect for other therapies. I don't think EFT is the be all and end all, and EFT is a good fit for me. And the research shows too, like that is part of what supports good outcome. It's not just the orientation, it's the fit between the
Mm.
orientation and the therapist. And yeah, I do hope that clients feel that and that warmth and acceptance in a room with me too.
So is EFT for everybody, or, it's hard to pinpoint, that CBT is good for this person, or ACT, or DBT, or EFT. But is there sort of characteristics of certain people who you've noticed over the years of practicing with so many clients that where EFT really resonates with certain populations?
I don't know if I have a good answer for that question. It's not like, yes, all people with depression or, people who are experiencing anxiety or people who are experiencing eating disorders or complex trauma. It's like, yeah, certain people from all those groups could benefit from EFT, and there's good evidence for the use of EFT with people experiencing these things. I guess a few other responses I have to that are, there are a number of people who come through my door who might have tried other types of therapies like CBT, and they just haven't felt like, well, in some cases, like they find themselves back experiencing the same problems that they were, a year ago, or it didn't feel like it was kind of touching into where they needed to go. And so, that might be a case where somebody would want to explore EFT. Yeah, I don't know if I have a better answer for it than that, Andrew. I guess another piece of it would be, yeah, like I wouldn't say somebody has to be, gusto about exploring their inner world. We've talked about
Yeah.
how scary it is to
Yeah.
explore one's inner world, but, to have a little bit of curiosity about that could be helpful. If you are just wanting to talk about what is happening and you want your therapist to give you strategies, I am not the right person to work with you. That's not me. I'm not going to give you like the list of the 4 tasks that you're going to do
Mm.
between sessions. And, yeah, that's not what I'm going to do. I do give in between session homework based on awareness, but if you're looking for like things to like do, that's not me. And it's probably not EFT. Yeah, I guess that's another piece of it.
Yeah, I think, I'm laughing because, oh my gosh, I've had so many times where I'm like working with someone and then their partner or their parent or someone is like, well, what strategies is he giving
Yes,
you?
all
And
the
I'm like,
time.
oh, and then I,
Yeah.
a bit of like, I get a little bit like, oh, maybe I'm not doing my job right, or maybe so I'll check in with the
Yep.
client and they're because they can't really explain why the changes are happening or why they
Right.
feel differently. And I don't know if I have the right language or the right, conceptualization to really explain it to them. I'm very aware that they're having an experience in therapy that is changing the way they feel about themselves and the way they feel about others, hopefully. But yeah, it's hard, that other people don't understand. And so it seems like this magical or mysterious thing. And even in men's group, like we've had guys come back several times, and they'll say, I can't say what it is about this that is helping. And they'll use more colorful language than that.
Of
They'll say,
course.
like this, whatever it is about this, fill in the blank, but it's doing something. So I'm going to keep coming back, right? Like,
Right, right. It is so hard to put language on it, right? And to even communicate it in a way that makes sense to
Yeah.
clients. And I have found my work in couples to support me in kind of consolidating and kind of because there is this period in EFT too where we are like making sense of what happened in therapy room. We do want to like logically understand what happened. And, I'm just thinking about some of the couples work, like being able to name things like, wow, you just took that risk with your partner. You went into that place where you said, you know, when I kind of hear you say that to me, I go to this place where I feel like I'm not good enough, right? Like you shared that with your partner and you reached for him in that space and he received you. Like that was the antidote to that pain. That's why you feel better, right? It's like you felt into that really scary part where you don't feel good enough and you shared it. And this is why you're feeling more connected in this moment. There's relief in that. And so I don't know, I think there are ways that we can language some of this for clients to help them make sense of their experience. But yeah, it's hard, right? It's not like there are these check boxes that we're hitting in a way that might be true for other types of therapy.
Your
Yeah.
example there, Kendall, really resonated with me, even working
Mm,
with children and
mm, mm,
teenagers, like
mm-hmm.
putting language into the emotion. Because so many children who show up at the office here, they have difficulty with expressing themselves.
Right.
And not just on a cognitive level, but more so, I would say, on an emotional level. So many things come
Mm-hmm.
out as a quote unquote tantrum,
Mm-hmm.
anger.
Mm-hmm.
And in my office, even like a poster there, I've got like 30 emotions for kids. And even adults sometimes will look at that poster because they're just looking at, what are these emotions about? And when I ask them to label, many children I find they don't have the vocabulary. Even some adults won't have the vocabulary
Absolutely.
for it. And so when they have this visual, they can now go, "Oh, I'm actually feeling embarrassed, or I'm
Mm-hmm.
feeling ashamed or guilty." And it's like sometimes you see some of the kids and teenagers as they say that, like this weight is being lifted,
Yes. Yes.
where no one else has really understood how they felt or
Yes.
even asked the question. Because people just see the behaviors.
Yes. I love that you can bring that up. And, this kind of leads into how an EFT therapist can use emotion to support change, right? And what the research has shown about emotional change is that when we become aware of and we label our bodily felt sense, physiologically what's happening in our body, emotion is down regulated.
Mm.
There's something in just naming it. We talk about you got to name it to tame it. That's another one of our
Hmm.
kind of our lines, right? And there's something that can be really powerful about that. And it's really neat you've had that experience with kids, right? Where it's like, oh yeah, that's what that is. And another piece that we know and that the research shows is that emotion changes emotion. So if in a moment of shame, when we feel like we're flawed, like we're not good enough, like there's something wrong with us, and we can bring alongside another experience, maybe it's an experience of assertive anger towards, someone early on in our attachment experience who made us feel like we weren't good enough by the way they treated us. This can transform that emotion of shame, so emotion can change emotion. And something else, and I find this really fascinating as well, is that emotion can change memory in its period of reconsolidation. And so, what this means is that if we remember in the present, and this is, we were talking about how hard it can be to activate emotion in a session. This is not a first session experience, this is down the road. But if we remember in the present a memory of For example, a critical, abusive father looking down at you and the memory is activated, including, the images, the thoughts like, I'm not good enough, or there's something wrong with me, and the feelings like the shame. And after activating the memory, we experience something else like empowered anger or adaptive sadness or self-compassion. Within a 10-minute window of that being activated, we synthesize a new experience. The memory will synthesize into a new experience. Neurons that fire together wire together. So what that means is later on, when that pain is re-triggered, it won't be quite as hot. And that's when clients can kind of come back and say things like, I saw that man who abused me and I was okay. I didn't go back to that same old place of shame. So in that moment, that memory, there's been something kind of new about it. And in that moment, they can access some of that like compassion for themselves, as well as some of that assertive anger, rather than the, old shame they used to go into. And so, what all of this means for an EFT therapist is that we do try to activate emotion in the session. We do try to support clients to symbolize their bodily felt experience in words. We invite the expression of emotion, and we invite transformation of painful emotion through the expression of needs or the expression of other suppressed adaptive emotion, like that assertive anger I mentioned, or adaptive sadness or self-compassion. And, this is part of what I find so compelling and exciting about EFT is that we can do that hard but really important work that can really transform a client's emotional world. And then they're no longer stuck in these old, familiar experiences when they're triggered. It can be a really, really freeing experience.
Okay, I'm jumping in.
sorry.
I was waiting
Oh, yeah.
for you, Andrew, but
No.
I can't resist. I'm just like,
I was waiting for you. I thought you
yeah,
go
no,
for it.
we can see each other, but the audience can't. So, but yeah, Kendall, I sometimes think about like, CBT is kind of a top-down, trickle-down effect where you're changing your thoughts or at least reevaluating your thoughts, and then that can change the way you feel. But the experiential, emotion-focused work is like from the bottom up, and
It's the other way around.
yeah, you have an experience that fundamentally changes the way you believe things are. Yeah. So I'm mixing up my words here right now, but I did have a question that was going to go along with
I
this.
love how you get excited about it, though. That's how I feel too.
See, the emotions are just
excited.
driving my bus right now, and my prefrontal cortex just went offline, and I'm like,
Takes a while for it to come back, right? Yeah.
So now I'm naming it. Now I'm taming it. Okay, here we go. I was thinking about anger, and like again, because I work with a lot of men and see a lot of men, like the approach to working with anger. What would that look like from an EFT perspective? If someone said, "Ooh, I've been told I need to do some anger management because my relationships are not going so well, and here I am. I'm coming to your office."
Yes. Yeah. That's such a great question. I love questions about anger. And anger is like so taboo in our culture, I think, especially for women, and it also for men. If there's too much anger, it's like you have an anger problem. And I think to answer this question, I need to talk a little bit about emotion therapy. Is there space to talk about, emotion theory? Yeah.
Yeah, go for it. Yeah.
So emotions are adaptive. We feel in our bodies. They are a signaling system to us. It tells us what's important to us in relation to our environment. They're really important to pay attention to, right? It's like our inner compass, our inner signaling system. Les says emotions are ultimately a relational action tendency. They are a tendency towards action. And so, what happens when we have an emotion is we feel in our body. There's a label associated with it. There's a need, and there's an action tendency. So what this means is that we'll work through this. So let's say a bear comes in the room. We have that physiological experience of like our heart rate increases, maybe our breathing increases. We might get sweaty, our muscles might get tense. So there's this bodily felt sense with the emotion, right? And then there's a label. We know we can put a label of fear or like scared on this experience. And there's a need. We need safety. There's a bear in the
Mm.
room. And then the action tendency is I might, it's fight, freeze, fawn. What is it? Fight, flee, fawn, freeze, flop. I might have got all of them. And all emotions have a sequence like this. Anger
Mm.
does too. There's adaptive anger, right? It's like it powers up in our body. It like can, make us grow bigger and taller and stronger. And this is, we feel it in our bodies. It can feel hot, right? And we go, yeah, this is anger. And what does anger need? Like when I'm wronged, I want to be understood, right? And I want to be validated. I want you to tell me it makes sense that I'm angry, right? I need that when I'm angry. And an action tendency would be setting a boundary, right? Anger is ultimately adaptive. Sadness has a need for comfort and we can, seek a hug. So all emotions have this kind of emotion sequence and they are adaptive. So it's like, right, if emotions are adaptive, how can they cause us problems? How do we find
Mm.
men in things like anger management groups? So over time, what happens is that our emotions can get a little bit mixed up by our emotional and attachment learning histories. So for an example, as a child, maybe I learned it didn't go well when I cried. Maybe I was told like, stop crying. I don't know,
Yeah.
stop crying, be a man, or who knows, right? And so, as a child, already early on, kids can learn like crying isn't safe, sad isn't safe, but anger goes okay.
Mm.
Right? There are some emotions that are more acceptable in our world, and stereotypically for men, anger is more acceptable. Anger is, stereotypically less acceptable for a woman to show, and sadness tends to be more acceptable for women. So what happens is that we learn to cover our primary emotion, our first reaction to a situation with secondary emotion. So when we are sad, we're actually showing anger in some cases, which gets really messy because what we really need in those moments is comfort. And what we're showing our person is something really prickly and scary, and it actually pushes them away and we don't get what we need. And so, yeah, our emotion signaling system is wonderful, and it unfortunately can get messed up because of our experiences. And, these reactions that we can develop are actually quite adaptive in their original context
Mm.
because they help us survive. But then what happens, as we grow up or we're in a different context, maybe it was an abusive relationship and now I'm in a healthy relationship, that reaction is problematic in the current context. So, like, for example, if a little girl grew up with an abusive father, it would make sense that when she heard him raise his voice, she would buckle with fear and she would try to run for safety, or she might freeze if she can't get away, right? And fast forward to adult life, if this same woman is in a really healthy relationship, and it's non-abusive, and her partner raises his voice, even though she's safe, she might experience that same old reaction in her body. She's triggered by that raised voice, even though she is safe. And she can re-experience some of those old familiar feelings that are overpowering, right? Like freezing in her adult body, like she froze as a child. So what was in the here and now, she's experiencing in the here and now what she experienced there and then, is a way that we sometimes say that. The fear is no longer adaptive. It's no longer giving helpful information for her current environment. And in EFT, this is what we call primary maladaptive emotion. And this is primarily what we're trying to support a client with in the therapy room. It's to, it's what the primary maladaptive emotion is ultimately what is bringing a client into therapy. Is like kind of this stuck old feeling. And it is the emotion that we strive to transform in the therapy room. There are three main core categories of primary maladaptive emotion, and they are fear. Like for the example of, is somebody experiencing abuse in childhood or otherwise, lonely abandonment when there are experiences of, rejection or abandonment, and shame.
Mm.
So let's talk about anger in men and shame. It's like anger is an acceptable emotion. For the most part, it's more acceptable than sadness, certainly more acceptable than shame. And so when I think about men having experiences with anger that are problematic, I get really curious about shame underneath as a primary emotion underneath secondary shame, or sorry, underneath secondary anger.
Yeah, I think of the anger iceberg,
Right.
right? Like the
Yes.
tip of the iceberg is the anger, and
Yes.
underneath there's embarrassment. There's just so
So
much.
much
Yeah.
underneath, right? And it's like if we can kind of bring cure in a very safe environment, in safety and relationship, find a way to slow down and figuring out like what's really going on in those moments when that anger gets triggered.
Mhm.
What a rich place to explore.
I'm just thinking how powerful when you mention the primary maladaptive emotions, fear,
Mm,
abandonment, and shame.
mm,
Like all three of those, in and of itself, are such powerful emotions. But I can only imagine somebody who's experiencing multiples of those emotions, how challenging it must be.
Oh, it's so hard, Andrew. And like even for me, when I see it in the room, and like often people experience not just one but two, often there are kind of like two kind of core experiences of pain. And when it comes alive in therapy room, because that is the idea, right? It's like we're trying to get to this place and bring something else alongside it. So when it becomes alive in the therapy room, when I witness it, oh my gosh, it pulls at my heart, right?
Mm.
It's like witnessing somebody experiencing that kind of pain is, whew, it's deep and it's hard and it's painful, right? You're right. It is a lot.
I know you touched on couples therapy a little while ago,
Yeah.
and I'm even just thinking about these primary maladaptive emotions within a dyad in terms of couples work.
Oh, this makes me so excited, Andrew, because I'm not just bringing, in the case of individual work, I'm bringing it alive. And, there's classic interventions that include two-chair work, and there might be kind of an imagined other in the chair. It could be the self-critic, and transformation can sometimes happen in that context. But in couples therapy, I have another human in the room who can actually speak words into that place. And just like in individual therapy, going to primary maladaptive emotion is not the first step in EFT for couples. There has to be so much safety in the room before we can invite that painful emotion. This is a stage 2 place that we go to in EFT for couples, not a stage 1, where one partner, it makes me so excited, right? As I think about experiences that I've had witnessing couples do this, where they can go into that place and say, like, I just feel like I'm not good enough for you. Like in those
Mm.
moments, when I was showing anger, I'm actually in this place where I just feel like I'm not good enough. And the partner reaches for them and says, honey, you're everything I've ever wanted. Of course you're good enough. It's like, yes, that is the magic of couples therapy. That's the moment that we've been working towards, right? It's actually, as we learn to, even for myself as a therapist, as I've learned to befriend my inner world and be comfortable with emotion and in the room with me, with others, supporting them with it, I actually get excited, really excited as clients get into those painful places because I know that it's an opportunity for change. Kind of like a massage therapist discovering that knot will want to hang over it and know that there's an opportunity for some good work in that place.
And it's just painful after that when they find that knot.
Right. There is a therapy hangover component to this.
Yeah.
You're right. It's like, yeah, I feel a bit raw in that spot for a while. Absolutely.
Well, and also like even though there's those magical experiences that happen, right? Like those
Yeah.
corrective experiences where
Yes.
someone
Yes.
actually reached for someone and the other person responded and there's a connection. But then they go back home and the old patterns kind of kick in. And it's like there needs to be sometimes a lot of repetition, a lot like, sometimes one experience can really dramatically shift things, but sometimes people are quite frustrated that they had this really great experience in the therapy room and then they went back home and it was gone and they're like, are we failing at this or are we doomed because it's never going to change? And it's like, no, this is part of the process. So
Yeah. Yeah.
yeah.
Thanks for that. Right. It's like, this is not, EFT is not a magic pill. These magical moments in therapy are not magic pills. It's sometimes like a drop in the bucket, and we need more drops in the bucket. And you're right. It is part of the process. And for people who are coming in with these long histories of these experiences, we need to rake over it a few times, right? For it
Mhm.
to really stick, have those neurons that are firing together, wiring together a number of times in the room.
You were talking about your own personal experience with emotions, and
Mm,
one of the phrases, I got all these like phrases that I've picked up over time, but it was like you can only take clients as far as you've gone yourself, like especially
Yeah.
emotionally, like if you're avoiding certain emotions or you're uncomfortable with certain emotions, I find like this work really requires you to do your own work in that area.
Oh, yeah, absolutely, Dave. That's so important. And as you say that, I'm just kind of taken back to therapy experiences that have had. And I'm just so grateful for a number of people I've had come alongside me and done work with me in my life. And I can also say that I'm really grateful for an international group of EFT peers I connect with on a regular basis. And we do work together, right? Noticing what trips us up and kind of supporting one another in our personal and professional growth. And I will say also, there is a kind of daily maintenance piece to this too, where I have my own meditation practice and a yoga practice just to take care of myself and continue to kind of open up into these spaces inside of myself so I can better support clients. And, at the same time, of course, I'm not a perfect human being who has it all figured out. I really kind of accept that this is a lifelong journey for me. And that is part of what I love about this work.
That's amazing, Kendall. And even our talk today, how much I've learned, because EFT isn't my primary modality. Certainly, I mean, in grad school, we may have spent, I don't know, a couple of lectures on it, and that's about it. But I've been thinking about taking the EFT workshops at York with Les Greenberg. Haven't gotten around to it, but after our talk today, it's really motivating me and propelling me to sign up for that soon. So for me, this was so informative, and it really is just a drop in the bucket. I'm sure you could keep talking about EFT and the importance of emotions, but I think for today, we'll leave it here, and you can always find Dr. Kendell Banack at mh.ca. She does have a practice in Camrose, Alberta, and it's a Center for Restorative Mental Health. And you can also find her on Instagram at CRMH1 and also on Facebook at Center for Restorative Mental Health. So, Kendall, thank you so much. This was such a treat to have you with us. I'm sure our listeners are intrigued and have benefited from all the information you provided today. And I know I have really benefited and learned so much just
Mm.
within the hour that we chatted, and really, really appreciate you giving your time to us today.
Thank you so much for having me here. And again, it's just such a delight to be with the two of you. I care deeply about the two of you. It's so nice to connect, and it's just been a great opportunity to talk about what I do. And so that's been really fun. Thanks for having me.
Oh, one last piece I wanted to add. If you go on Kendall's website, check out Rural Mental Health. I really gravitated towards that. I thought that was really cool. We didn't even touch on any of that today, but I'm going to make a plug for you. I know you
Ah,
didn't ask for
cool.
this, but I thought it was just really cool what you're doing with rural mental health.
Cool. Thanks, Andrew. Yeah.
Yeah, thanks so much, Kendall. I am filled with gratitude. It has been so nice reconnecting, and hopefully we can do this again.
Yeah. Thanks so much, Dave. Thanks, Andrew.
Take good care, everyone.
Take care.